steps and components. 1. Synthesis of ACH. Choline plus acetyl-CoA are combined by the enzyme choline acetyltransferase AT to produce acetylcholine in the axon terminal. 2. Storage in vesicles. ACH is stored in vesicles until it's ready for release. 3. Release of H, calcium CA-quasamine, enters the neuron terminal through voltage-gated channels when an action potential arrives. CA-quabi triggers vesicle fusion and exocytosis into the synaptic cleft. 4. Action on receptors. ACH binds to muscarinic receptors, M1, M2, M3, on the postsynaptic neuron or target cell, triggering various physiological effects. 5. Termination of ACH action. ACH is broken down by the enzyme acetylcholinesterase, HHE, into choline and acetate. Choline is taken back up into the neuron for reuse. Drugs that affect this synapse. 1. Botulinum toxin, cholinergic inhibitor, prevents the release of ACH from presynaptic vesicles by inhibiting vesicle fusion, leads to flaccid paralysis. 2. ACHE inhibitors, e.g. donepezil, cholinergic stimulants, inhibit ACHE, prolong ACH presence in the synaptic cleft, enhancing cholinergic activity. Used in conditions like Alzheimer's disease. USMLE style question. Question 1. A 65-year-old woman with Alzheimer's disease is prescribed donepezil. What is the most likely mechanism by which this drug improves her cognitive function? A. Stimulates M2 muscarinic receptors directly. B. Inhibits acetylcholinesterase, increasing synaptic ACHC, blocks choline uptake into presynaptic neurons. D. Stimulates presynaptic nicotinic receptors. E. Inhibits release of acetylcholine vesicles. Correct answer, B. Inhibits acetylcholinesterase, increasing synaptic explanation. Donepezil is an acetylcholinesterase inhibitor, which increases ACH levels at synapses by preventing its breakdown. This improves cognitive function in Alzheimer's patients. A. Muscarinic agonists are not the primary therapy here. C. Choline uptake is needed for ACH synthesis. Blocking it would reduce ACH. D. Not the mechanism of donepezil. E. That's what botulinum toxin does. Question 2. A 35-year-old man presents with descending muscle weakness. He is diagnosed with botulism after eating improperly canned food. Which of the following best explains the pathophysiology behind his symptoms? A. Activation of muscarinic receptors at the neuromuscular junction B. Excessive stimulation of nicotinic receptors on skeletal muscle. C. Autoimmune destruction of acetylcholine receptors. D. Inhibition of vesicular release of ACH from presynaptic neurons. E. Inhibition of acetylcholinesterase at the synapse. Correct answer D. Inhibition of vesicular release of ACH from presynaptic neurons. Explanation: botulinum toxin blocks ACH vesicle fusion, so no ACH is released. This prevents muscle contraction, causes flaccid paralysis. A and B, botulism causes lack of stimulation, not excess. C, that's myasthenia gravis. E, that's the mechanism of ACHE inhibitors, e.g. organophosphates. Question 3. Which of the following most likely results from inhibition of acetylcholinesterase? A. Decreased salivation. B. Decreased GI motility. C. Meiosis and bradycardia. D. Dry mouth and urinary retention. E. Skeletal muscle paralysis. Correct answers, and bradycardia. Explanation: ACHE inhibitors increase ACH levels, overstimulate muscarinic receptors. M2 slows heart, M3 causes pupil constriction, so you get bradycardia and meiosis. A and B, ACH increases secretion and motility, not decreases. D, these are anticholinergic effects. E, paralysis occurs with botulinum toxin or in myasthenia gravis, not from ACE inhibitors. Let me